All right. Hi, Mike Freelander. Welcome back to the Stephen Shores radio show. Happy New Year for 2022. How are you?
I'm good, and I'm hoping 2022 will be a good year.
Yeah, there's been a lot of corruption up in federal politics, Mike, as well, with Gladys Berejiklian as well. She's not premier anymore. Daniel Perrottet's taken over the job. The healthcare system's been in trouble.
Under stress.
Yeah. Nurses have gone on strike because of the Omicron variant. You know, you can be double vaccinated and still catch the COVID virus. You know, and when you listen to Fox News, they just will bombard you with very anti-Biden claims as well.
Mm.
You know, and how have you found federal politics for yourself?
Well, it's been quite stressful, and I think a lot of it reflects the desperation of the Prime Minister trying to wedge Labor on certain policies. But I mean, we're in election mode. I want the election to come on. I'm happy to fight it on Labor's policies in education, in health, and in the economy. And I think the Prime Minister is looking pretty desperate. So I'm optimistic that we'll have a Albanese Labor government, but I think we need to work at it and get our message out there. I actually do feel quite optimistic about the future now. I think that, the pandemic has shown it can be controllable and that we can live with it. And to give credit where credit's due, I do think that governments have been doing pretty well across the spectrum, from Labor to Liberal governments, state and federal. There are some things we'd probably do a little bit better if Labor was there, but I think that all in all we've had a good response, and that's prepared us well for an expanding economy, more jobs, increases in wages, and a pretty optimistic next year or two. I mean, there are some storm clouds, unfortunately, on the horizon. The imminent invasion of Ukraine by Russia is a concern, particularly also for our economy. And I think also, the pandemic's not over, so there is still potential for new variants. And, of course, a lot of the third world in Africa and South America and Southeast Asia, a lot of those countries don't have very high immunisation rates, which means the virus can still spread and mutate. So we're not through this altogether, and we do need to make sure we help those third world countries to get their populations immunised. There are also, looking at changes in our immunisation use as we prepare for the new variants, and so that's important as well. So there are still some issues, but overall I feel quite optimistic about the future.
You remember 100 years ago was the Spanish flu, Mike? That was a very bad pandemic. It killed more people than World War One. But there was no vaccine for that, and it was similar times what we're living in today. People panic buy, mask wearing. Did you study the Spanish flu? Wow.
Indeed. And we learned a lot of lessons from that, and that's where a lot of our social distancing policies came from. And that pandemic, unfortunately, it lasted 8 or 9 years. So, that is a cause for concern, and people should not be discounting the fact that there still could be problems with the pandemic. But we have immunisations now, which hopefully will allow us to shorten it. We're more prepared, and we have better medical facilities. So, I'm optimistic.
I've been reading the Sydney Morning Herald. I subscribe, and they talk both about the right and the left in politics in this nuclear submarine Scott Morrison's ordered. Do you think there's a need for a nuclear submarine?
I don't believe that we need to be taking the nuclear option. I think it's very unlikely these will be built in Australia. I think that we will probably in the future be looking at electric submarines. And I think that the nuclear option is not a good one. It creates hazards, and it also, in Australia, we don't have the expertise to deal with nuclear-powered submarines, so it would mean we'd probably have to import people from overseas to deal with it. And I think there are better ways of spending that amount of money. And as I said, I think we will be looking at probably electric submarines before too long. So I think it's going to be another waste of money from this government, which has already wasted about $5 billion or more on the French submarines, which they've now scrapped. So this is a government that, full of promises but never delivers properly, wastes billions of dollars of taxpayers' money, and has a very unclear view of the future. And I think Labor would offer a lot better in the way of economic management. This is a government that's put us trillions of dollars in debt.
So there's things. Let's talk about Campbelltown Hospital. I'm not very happy with the health system in Campbelltown or the public hospitals. I feel that there's too many medical students. You don't get a lot of experienced people like yourself, and they're very, very slow, Mike. My grandma's been through there, and it's a pain.
Look, I think all health systems have been under stress because of the pandemic. We've always had a problem at Campbelltown with the population increasing rapidly and the resources not keeping pace with that population increase. But I still work at the hospital. I'm still doing a clinic there.
Public
I have a lot of respect
private?
for my colleagues. Public.
Yeah.
And I have a lot of respect for my colleagues who are really doing or have done a magnificent job. I mean, our mortality rates with COVID are amongst the lowest in the world. We've had fantastic ICU doctors. So I think they've coped well with that. Where there are problems are things like emergency. There's long waits simply because of the population pressure. The government has invested significant amount of money in the redevelopment of the hospital. So physically, there are good facilities, but where the problem will lie will be in recruitment and staffing. We're always forced to play second fiddle to other hospitals in the inner city, etc., whereas we struggle with staffing. So I'm very hopeful that we will get the resources we need and deserve. But that's one of the things that I keep pushing for. It's not just the physical resources, it's the staffing and the expertise. But all in all, our health services have coped very well during the pandemic, and I fully support them. The medical students, we get quite a few these days from Western Sydney Uni and also from University of New South Wales. I'm always happy to have the medical students there. I think we provide good training for them. And I think they're a help rather than a hindrance. But you're right, we do need more senior staff, and we do need more nursing staff and better, facilities for our patients. So they're the things that I keep pushing for.
Yeah, that's healthcare, Mike. Do you think a private health system's better?
I think that in some instances, private healthcare has advantages, particularly in high volume areas, things like procedures, and short stay, day stay type surgery, eye surgery, ENT surgery. So I've always believed in Australia we have the best of both worlds in the way our public health system deals with the chronic and complex illnesses. Private healthcare deals with the short stay type procedures, and they work very well together. And I have always encouraged people, if they can afford it, to take out private health insurance. And by doing that, we look after our own health. But the public and private systems work well together, so I support both. And I worked in both for over 40 years.
Exactly. There's so much corruption up in federal politics as well, Mike. You know, Eddie O'Beid with the dodgy deal with Gladys Berejiklian, Dominic Perrottet.
That's all state politics, Stephen. I don't think there is much corruption in federal politics, but I do think we should have a federal corruption commission or integrity commission with wide-ranging powers, and I think that that's a really important thing that I would like to see continue. So,
how do you feel about
Labor has pushed for that, and we will continue to push for it, even before the election and after the election. We need a federal integrity commission because people need to see that politicians are kept to account.
How do you feel about Dominic Perrottet?
Look, I think that he's made some missteps in his short time as Premier. I think he's an intelligent man. I think he's very conservative. And I think that he has much to learn. I think he's done some good things, and I think the way he's opened up our education system is good, getting kids back to school. And I think that some other things he could have done a little bit better, like, opening up a bit too soon and not resourcing health the way he should have. I'm encouraged by some of his remarks, particularly about our Indigenous community. But I do fear that he is very, very conservative, and I think that he will continue to make mistakes because he is very ideologically based.
It's a complicated business politics, Mike. It's can get
it is
confusing because you got Scott Morrison. It's not an easy thing to be a prime minister in a pandemic, even if you were the Labor, Liberal, Independent.
But yourself, it's not easy. No one's saying it's easy.
Are you going to be a premier one day, or what are you looking at doing?
No. I have no ambitions to be prime minister. I'd like to be health minister at some stage, but I'm still a political novice. So I've got my time to serve, but I have some ideas about reforming the health system and also our social security system. And I'd like to also help support those involved in the NDIS.
Yeah, I left the NDIS. There was just stuff I wasn't happy with. I wasn't getting what I wanted out of it. The services given to me were not for me.
Well, it's certainly not perfect.
Exactly. But, there's a lot of things happened over Christmas. You couldn't even get a COVID test, Mike. You couldn't even get a rapid antigen test. It was like a 2-hour line.
I know.
Anthony Albanese.
There have been real deficiencies.
Yeah, Anthony Albanese was going off his head on Sky News to the Prime Minister. Malcolm Turnbull sort of turned against the Prime Minister as well of Australia. So it's quite interesting how this year's election's going to be. You know that?
Yeah.
But healthcare is very important. As we,
It is very important.
But it was just ridiculous. People were just scalping rapid antigen tests, Mike, over Christmas.
I know. Well, that was poor management by the Prime Minister, unfortunately, and we knew that we had to have them earlier, but we didn't get them. So terrible. Yeah. Stephen, I'm going to have to go shortly.
Yeah, thanks for coming on, Mike.
Thanks for having me, and all the best, and we'll talk again soon.
You too, Mike. Okay? Take care.